So I've been talking about the orbital cavity or the orbit a few times because it's really beneficial to just kind of understand the anterior view of these cranial and facial bones. So, in the orbital cavity, however you want to say it, orbital cavity, orbit, either is fine. There are 7 bones that join together to form this eye socket where the eye is going to, and associated structures are going to sit. Okay, so 3 of these are cranial bones and 4 are facial bones. So the 3 cranial bones used to make up the orbital cavity are the frontal, which is shown in blue, the sphenoid in green, and the ethmoid along the medial side of the orbital cavity in an orange. And then you have the facial bones. They are the palatine bone, which is in blue, and the zygomatic in like a salmon orange color. Um, I really hate how I just said salmon. That is going to stick with me. Anyways, I should re-record. No. So then the lacrimal bone is in a dark purple along the medial edge, and the maxilla in yellow, forming the floor of the orbital cavity. Okay. So all of those bones make up the orbital cavity. The nasal bone does not, right? It's kind of like the maxilla swooped in and kind of came up and was like, "Get out of here, nasal! You can't be in here." So, anyways, so make sure that we can identify the bones that make up the orbital cavity, either from an image or just kind of talking about it. And it should always be, or it is always good practice to break it up into the cranial bones versus the facial bones as well. Okay. So, some other things going on in the skull are sinuses. Okay. I'm sure you guys have all had, like sinus pressure, like, getting sick and having, some headaches and whatnot, all this buildup in your mucus, and it's disgusting. And you got these headaches and it just hurts and you just want to lay down all the time. So now we can actually name them and kind of think about the function of them and understand why we feel the way we feel when we're sick. All right. So these are called paranasal sinuses. And these are essentially just cavities in certain cranial and facial bones. So there are 4 of them, and these are lined with mucous membranes. So keep that in mind. Okay. So it's kind of like continuous with the nasal cavity. But the reason that they're here, these are allowing the skull to increase size without change in mass. So that's incredibly beneficial. We don't want a heavy head, all right? So it just kind of keeps the weight down of our skull, just because these really are cavities posterior to the nasal cavity. All right. So some other things to just keep in mind in terms of function, right? These are, again, lined with a mucous membrane. So there is going to be obviously a lot of mucus production. Now, this is really beneficial because this is going to help moisten and cleanse the air. Okay. So when we get to the respiratory system, which probably feels like forever, but towards the end of the semester, we'll talk about different zones of the respiratory system, one of them being the conduction zone. The conduction zone's job is to bring in air, moisten it, warm it, and then also filter it. So if the air is passing through the nasal cavity as well as the paranasal sinuses, it's going to just be cleaned out and moistened even more. Okay, so it's just increasing the surface area, just allowing better air to be entering our body. All right. Now, another thing to remember is that these paranasal sinuses are also resonating chambers. All right. So, what I mean is they allow kind of an echo within the skull. So, they intensify and prolong sounds. So, they enhance the quality of your voice. All right. So when you have a cold, the passageways that sound would be, traveling in and out of the paranasal sinuses becomes blocked because there's all of this excess mucus production. And so when you're sick, or even if somebody's getting over a cold or just about to start a cold, you can kind of hear it because the quality of the voice changes because of this excess mucus production, because your resonating chambers that are the paranasal sinuses become blocked. So that's just kind of a fun thing to think about. Okay. So I'm not going to necessarily have you identify them ever, but you should know at least the bones that house these paranasal sinuses, and they would be the frontal sinus, the frontal bone with the frontal sinus, ethmoidal bone with the ethmoidal sinus, the sphenoidal sinus with the within the sphenoid bone, and the maxillary sinus within the maxillary bone or maxilla. All right, so from this anterior view, it kind of looks like the ethmoidal sinus is sitting right on top, but from this lateral view, you can see that the sphenoidal sinus is posterior to those ethmoidal sinus. Okay. Then something else, looking at an infant skull. So you're not necessarily going to have to know specific markings or anything on an infant skull, but you should be aware of something called fontanelles. All right. So if you've ever been around a baby or just heard about a baby, you probably have heard that babies have soft spots, right? And you're not supposed to press on them because it's incredibly dangerous to the baby's health. And that is true. But those soft spots, the actual term for them is fontanelles, right? And so essentially you have these cranial bones, right? You have the parietal, the occipital, the frontal, the temporal, the sphenoids, ethmoidal bones as well. But in between them, instead of having a suture where, the bones have completely articulated and, been fused together, instead they have these spaces filled with mesenchyme. If we remember mesenchyme from our tissue units, mesenchyme is embryonic connective tissue. So that's the type of tissue that all connective tissue develops from. So in between all of these cranial bones, we have mesenchyme, and each fontanelle is going to close at a different point in time of the baby's life. But really, all you need to know is that around 2 years old, which is what 2 years old, that is when all of the fontanelles should be closed, and those suture lines will have been formed. Okay. I do not need you to label any of these fontanelles or anything like that. Just be aware of this information. Again, be able to understand that where they close, where they're fused, where the mesenchyme is where there will be a future suture. Right. Cool. Now let's talk about the hyoid bone. The hyoid bone is a weirdo. It is not actually part of the skull, right? But it's attached to the skull via muscles and tendons. Okay. So it is the only bone in the body to not articulate with any other bone. That's crazy, right? Because bones touch bones. That's what we know, and that's how we get that structural support. But the hyoid bone does not. If we want to locate the hyoid bone, we can, put our neck in the position that this person is in our image, kind of tilting it to the side, and we can kind of feel up where our neck meets our skull, like right at that little corner. Or if we were just looking forward and looking at the skeleton, right at that right angle, 90-degree angle, we'd be able to feel the hyoid bone. or you can put your head in this position and tilt it all the way back, and you'll be able to maybe feel that hyoid bone. Okay. It is right above the Adam's apple, which everybody has, by the way. It's just males are more pronounced. Anyways, what we need to know on the hyoid bone is the body, the lesser horns, and the greater horns. So the body is this more anterior portion, and then coming off of the body, you have a lesser horn projection, and then these larger, more posterior projections called the greater horns. The function of these guys is really just muscle and ligament attachments. Need to be able to identify those though. When we get into the respiratory system again and we introduce the larynx, we will also come back and talk about the hyoid bone because it is kind of connected to that cartilage of the larynx, which again, this is the Adam's apple. It's part of the larynx.